When I was undergraduate at Western, I was on the national swimming team, and I got what we now call swimmer's shoulder, but couldn't find anybody that knew what it was and could help me. And eventually I got referred to Dr. Kennedy, who knew what it was and gave me an injection. It felt well after that, and I was able to participate in the Pan American Games. That was my first inkling that there was such a thing as sport medicine, although I don't think it was called that then. When I graduated from medical school, I went to the University of Michigan to intern. I didn't know what I wanted to do, and while I was an intern, I got convinced that orthopedics would be what I should do. And so I had to apply for a year of general surgery, which I did, and I was doing my year of general surgery when I applied for the orthopedic program because we didn't have one in London. And after I got accepted from that, I told Dr. Kennedy, and he said, well, we're going to start a program back here, and I think you should come back and be the first resident. So I had to tell them in Michigan what Dr. Kennedy said, and they all knew him. They said, you better go back. And we understand. You better go back and do your training with him, which is what I did. So I spent 3 years, 2 clinical years, and 1 year of teaching anatomy and doing research. When we finished that, he said, you need a year of finishing school. And he sent me down to Duke for a year. They call that a fellowship now, but to him it was finishing school. So I did a year at Duke. And again, there was no such thing as sport medicine per se, but everybody did a little bit of this and a little bit of that. At any rate, I had a good year at Duke, and I came back into practice with him at Victoria Hospital. There was no university hospital then, in 1970. In 1966, when I came back as the resident, he became the team physician for the football team at Western. And that meant for the day-to-day things, even though we were at Vic, that was me. And we were in the 4-team league then with Queens, McGill, Toronto, and Western. And he didn't want to go to Queens or McGill, so that was me also. So I was thrown into the fray when I didn't know very much about it. And it so happened that the athletic therapist on the team was a chap called Dave Wise, who was very good to me and taught me what I needed to practically know about what was going on with the injured players on the field. And since then, I continue to be taught by physiotherapists practical aspects of sport medicine all the time. And then in 1974, Alumni Hall was finished, and in the basement of Alumni Hall was a room where the wrestling team could practice. And so their former home for practice was room 20 Thames Hall, called the Combatives Room. It was wall-to-wall mats, as I recall. And that's where they practiced, not where they competed, but where they practiced. And it wasn't a very big room, but it was big enough for them. And he had the foresight to talk to the then president of the university, Dr. Williams, and the head of student health, and convinced them that this, since the wrestlers moved out, this room could be turned into a sports medicine clinic. So this was 1974, and he ran it Monday, Wednesday, and Friday from 4 to 6. So there was just the orthopedic surgeon, and if he had a resident or something, that was Dr. Kennedy's resident would be there, and one physiotherapist. And the rest of the time it was closed. And I would ask him from time to time, why don't we get somebody, a family physician or somebody that's interested, we keep it open. He wasn't interested in that. So it was just 4 to 6, Monday, Wednesday, and Friday. But after a couple of weeks of the first year, he said, Fowler, why don't you take the Fridays from 4 to 6? So it was Monday and Wednesday for him and Friday for me from 4 to 6. Dr. Kennedy retired in 1982. Dr. Harvey Bailey became chairman. By then, the university hospital was well established, and Harvey felt that I should move to the university hospital so I could easier do the sports at Western, and which was good. And so they set up. By then, I was very much involved in arthroscopic surgery, and so they set up a room at University Hospital for arthroscopic surgery, and it was quite convenient for me. I could go over to Thames Hall. By then, in 1984, I was at the Sarajevo Olympics, Sarajevo, in the old Yugoslavia, and one of the family sports medicine physicians with me was Derek Mackesy. And while I was there, I convinced him that he should come down and work in our clinic, and we could open it up full time. So that was sometime after 1984 that we opened the clinic full time. And then the problem was it got busier and busier and busier. The president of the university called me in the early 90s and said, this clinic is not really student health, because we had people coming from all over the damn place. And it was a traffic snarl and all the rest of it. So we're going to cancel the management of the clinic unless you want to move it over to student health, which I didn't want to do. So I was quite distraught and was actually looking at a couple job offers that had come my way when Mr. Pat Blewett, who was the executive director of the University Hospital at that time, decided or told me that University Hospital would take over the management of the clinic. And so they made the arrangements with the university, and so we kept the clinic there in Thames Hall. And it continued to grow, and eventually we were forced to find new quarters, and that's when the plans came in, I think in 1995, to build the new clinic, which finished in 1996. One of the people that was pushing for the new clinic was Bert Taylor, who was the dean of kinesiology at the time, because we have quite a connection with kinesiology in that they had a sports medicine arm to their program, and the people in that were the student trainers for the various teams, and they worked in the clinic with them, and we taught courses in kinesiology and so on. So we had quite an arrangement with kinesiology. He went to the dean of medicine, and he agreed, and they had the plans in place damn near before I got wind of it all. After we opened the clinic all day, every day, primary care became more and more a part of it. And although Derek Mackesy was the first primary care physician, we eventually grew our own as well. And as we see now, concussion and other things have taken over a major part of our treatment. I think Lisa told me last she counted there were 5,000 patient visits per year coming in for concussion, which is unbelievable. Now the patient base is pretty broad. It goes all the way from the professional athlete down to the weekend warrior sort of person, and that sometimes we're not very strict on that, but usually musculoskeletal injuries, but not always. The primary care people treat all medical problems that may be associated with sport, and that's been the big change in the clinic over the years, I would say. About the time we moved into the new clinic, we started expanding our footprint, and the first was Fanshawe College. They actually came to us to see if we would open up there and look and not only do sports medicine but look after their student health. And that's when Lisa Fisher actually took the first job there and did a great job. And that's what it was. It was student health and sports medicine. not just for Fanshawe students, but for people that lived in that area of the town. Not long after we started the clinic at Fanshawe, we were approached by Good Life Fitness to have a small operation down there, which we've done, which has been very successful. So these two other locations help us cover a lot of the non-student athlete population that we treat. The origins of our, quote, sports medicine was looking after the teams at Western. And actually, when we think about the various societies, the American Orthopedic Society for Sports Medicine, they were started by a bunch of folks that were team physicians. And so that continues to be an important part, in my thinking anyway, of what goes on at the clinic. And there are enough teams that we can have most of the residents and fellows and physicians, working physicians, look after teams. And then, of course, it comes with student trainers who get an education in this as well. So this is an important part of our whole operation. When a physician's looking after a team, particularly a university team, you got to remember they're there for their education. It's not their life, and safety is a prominent thing in your management here. And if there's a possibility of further injury, then you got to keep them out. And if you're not sure, you keep them out until they're evaluated by somebody else later on. But safety first is the best thing. We also look after some teams in the city, including the London Knights and the London Lightning. And I think this is important to show that the high school athlete and the professional athlete are getting the same quality of care.
But I am very, very proud of the facility. It's just an excellent one, and you can travel to the high-powered places of the United States where they're known for their sports medicine facility, but person for person, brick for brick, I don't think you'll find one any better than this one.